The two common cruel tricks IVF patients are subjected to by their IVF doctors. An IVF cycle is full of ups and downs and uncertainty, and you never know what's going to happen next. You're happy that you're growing follicles well, but the eggs may not be enough, or the eggs may not be mature, or they may not fertilize, and you're never really sure what's going to happen next. And all this uncertainty takes a toll, and that's why there is a lot of emotional stress. But there are two cruel things which bad IVF doctors do which actually make it much worse. The first is they transfer dead embryos back into the uterus. You might wonder why they do that. I mean, the dead embryo is obviously not going to implant and become a baby, so shouldn't they just be honest and tell the patient, I'm sorry, your embryos are dead, or they didn't fertilize, or they didn't cleave, or whatever the truth is. But they don't. They hide the truth from patients, because they're scared that if they tell the patient the truth, the patient will get angry and upset or will demand their money back. So they don't want to take any responsibility for the fact, for example, that there was an infection in the IVF lab which killed all the embryos. And they take advantage of the patient's ignorance and gullibility because they don't provide any documentation, any photos. They call all the embryos grade A embryos, whatever that means. And because there are no photos, patients don't know that those embryos were dead or not. And to add insult to injury, these same cruel doctors will then give an HCG injection after the transfer. Now, as you know, a urine pregnancy test measures the presence of HCG in the urine, and if it's positive, that means the patient is pregnant. Now, if the doctor gives you an HCG injection after the transfer, this HCG injection is going to go into the bloodstream, which means a beta HCG blood test is going to be positive, and it's going to go in the urine, which means your urine pregnancy test is going to be positive. And then you're on top of the world. You're so excited. What a great doctor. My IVF cycle worked. I'm finally pregnant. This was such great treatment. It's only when you repeat the blood test that you realize that it's not doubling. And that's when you finally realize, hopefully when you've done your own homework or got a second opinion, that you realize you were taken for a ride and the doctor was just cheating you. And the trouble is that once you've had one bad doctor who's cheated you, you're not going to trust any IVF doctor in the future. And this is such a shame. And that's why it's so important that patients demand some information even before starting the IVF cycle. And the most important information, and it's such a simple question you can ask and make sure you get an answer, is, do you give embryo photos routinely to all your patients? And seeing an embryo photo will give you 100% documentation that did the doctor create good quality embryos for you or not. Good clinics do this routinely. It's a global best practice. Make sure your doctor follows it too.